Delighted to have you all here. I'm going to go over our procedures quickly for the call, and then we'll get into the great content we have. We have a great session planned for you. We're going to do things slightly differently to increase engagement per your requests. So we'll talk about procedures for the first 5 minutes, and then Sharon Heseltine and Kim Hilliard will present for us. We'll have a couple of breakout groups during their presentation to get some engagement, and a great video that we'll watch on the topic of peer support specialists, the role of peers and families for recovery. And then 2 of our great participants and facilitators are going to talk about the work that they do as peer support specialists. That's Bethany Wilson and Marie Weiss. We'll give you a chance to ask them some questions after they share, and then we'll have a brief breakout after their presentation. And then we'll come back together for some full group discussion at the end of our session. So that's what our day looks like today. Just a couple of reminders. Please put your name and in your chat and turn your cameras on so we can all share together. We have lots of resources for you on the resource site. I want to let you know of a couple new ones. There's a peer support specialist training opportunity at Northern Kentucky University. It's in the resource folder. We also have our Project Scope Slack site that we would love for you to join. This is updated information from Miriam. She's on the call today as well. This information is here in the PowerPoint as well as in the resource site. So she sent us an additional great information on trauma-informed intervention. So I direct your attention to that. Just a heads up before I introduce our speakers, because we're going to go into breakout groups pretty early on in our presentation, that requires a lot of coordination on Brandon's part. So if you're not in the same group that you're used to for these breakouts, please understand that it's only the time factor. So I am now happy to introduce our speakers. We have Sharon Heseltine, who you all have met before. She is president and CEO of Heseltine Consulting and Training. She is an expert in addiction and recovery. She provides technical assistance across this state and other states as well through the Opioid Response Network. And she is a child and infant mental health specialist, among lots of other things. We also are glad to welcome Kim Hilliard today. Kim has a background in counseling and guidance. She's got lots of years experience in advocating for elder care, and she has a lifespan approach to recovery and services. We are delighted to have both of those ladies here, and I will turn it over to Sharon and Kim.
Thank you.
Thanks, Carolyn. Let me go ahead and get the slides up for Kim, who's going to start us off. And Kim, you'll tell me if you're seeing something incorrectly there.
I am seeing full page slides, so I think Houston, we're ready. We're ready to go. All right. So welcome everybody. It's nice to see everyone. I wasn't expecting quite this many, so that's always encouraging when people are excited about a topic. So today we're going to talk about the role of peer support specialists for families in recovery and who may be seeking recovery services. And we have 4 learning objectives for you today. The first is to gain an understanding of the nature of peer recovery support services and of the peer support specialists themselves within the continuum of care for substance use disorder treatment. We'll also explore the roles and functions of peer support specialists as it specifically applies to pregnant and parenting families. And we'll examine the various settings that utilize peer support specialists as professionals in a multidisciplinary team, and illustrate the proven effectiveness of peer recovery support services for persons who are seeking recovery. Everybody jazzed about that, right? You ready? Let's dive in.
Whoops. Sorry, Kim.
Okay. So when we talk about peer recovery, what are we talking about? And it boils down to a process of giving and receiving non-clinical assistance and support for long-term recovery from substance use disorder. So the non-clinical piece is important because peer supports have that lived experience, right? They've been there. That's the boots on the ground. They know what it's like to be a person who is in active addiction. And now have achieved a pattern of long-term recovery for themselves. So when it comes to street cred on recovery, that's where the peers come in. They have a link to this that we as often therapy specialist professionals don't have, right? We have the clinical experience. We don't have the real world experience, or most of the time do not. A peer support specialist, like I said, brings that lived experience of recovery. That combined with in-depth training and supervision to assist others in initiating and maintaining recovery. And one of the things I like to bring up, one of the peers that I work very closely with, and she won't mind me sharing this story, but Misty May from the Lake Cumberland area. She's just a phenomenal peer support specialist. But she talks about how she feels that her life has come full circle, that she was once that person in active addiction, had lost her children, was court involved, all of those things. And for a time, she was also a drug dealer to help support her addiction. And now she considers herself to be a dealer in hope. She said that she's a new kind of dealer now. She's a dealer of hope. And I think that's so cool, because that's exactly what peer support specialists do, is really provide that hope, because they have been there and can show that path. But also acute care substance use treatment without other recovery supports and community connections, we know that that's often not sufficient to help people maintain that long-term recovery, right? Because what we know is that treatment, that occurs in the clinical setting. But recovery, that's the stuff that happens at home. That's the stuff that happens in the community. And the peers are the bridge to both of those things, that connective link to both clinical treatment and recovery services. So through those supports, they help people in recovery to build what we call recovery capital, which is the internal and external resources and connections that are necessary to begin and maintain recovery.
Thanks, Kim. So, right, what you think about, what does peer support exactly look like? And in some ways, it may resemble in different ways other kinds of professional roles. If we think about programs that have multidisciplinary staff, there's probably a little bit of pieces of it that resemble family kind of support services, or a little bit of case management, so on. But it's also, right, a unique profession unto itself. So peers can provide support in a way that is emotional support, where you're bringing that lived experience to the table. You know, one of the ways that may look, when I think about families, let's think about families involved with child welfare with DCBS, and you're going to court, right? We're going to court. We're going to court next week. We're going to find out if we're getting our kids back. We've been doing everything in our family service plan. To have someone in your life who's there emotionally supporting you and knows what it feels like to be going to court next week, and what it feels like that day it's going to get decided whether you get your kids back, or when you get them back, what does that feel like when you didn't have them at all and you had some supervised visitation, and now next week you have them full time, right? Having someone who's lived that and knows what that feels like and understands how do you navigate all of that, along with a program of recovery, I mean, all the other things, is just a huge, right, huge emotional support. So, and then there's affiliation. That's the support provided by a peer that helps people learn different kinds of social skills. One of the key things that helps support folks in recovery is being involved in some type of a mutual aid group in their community, whether that's a 12-step program, like we hear a lot about Alcoholics Anonymous, Narcotics Anonymous. There's faith-based programs like Celebrate Recovery. There's programs called Smart Recovery. There's a lot of different mutual aid groups, and they're very helpful. They help people develop tools of recovery. They also help folks find an entirely new social network, because one of the things that you have to do in recovery is I was told myself in early recovery, you only have to change one thing, everything, but you need a whole new social network when you go into recovery. And one of the things that substances do for people and have done for a long time for a lot of people who are going into recovery is that they made you feel comfortable in a social setting. So having a peer support that helps you navigate these not only new settings, but settings with people who talk in a way that you don't fully understand. And to be honest, I mean, I'll be really honest, like when I first got in recovery, I felt like I was a 13-year-old girl again. So if anybody remembers what it felt like at 13, when you were so incredibly uncomfortable in the world, for many, many people in recovery who are, you know, a way older age, you get to go through that all over again and kind of rebuild that comfort, right? So having someone help you navigate that, such as a peer support who's been there, who gets it, is really helpful. Peers also provide information, right? They share knowledge, information. We see peers in intensive outpatient programs or residential treatment programs, maybe leading life skills groups and other kinds of activities like that. So they can provide instruction one-to-one or in group settings. And then peers also provide support in this area of instrument, but helping people get concrete assistance, whether that is getting different kinds of services that they may need, support around transportation, other kinds of community services, and getting your kids enrolled in Head Start or childcare, you know, any of those kinds of things. Peers are able to help with that. And that's going to look different in different organizations, depending on what the overall multidisciplinary team may look like. In some organizations, that's always going to be case managers who do that kind of instrument support. But many times, case managers and peers will kind of work in tandem with each other to help families. When it comes to families in early recovery, particularly with young children, when that all happens at once, the need for services and support is pretty extensive. So, right, peers engage in a lot of different activities. It may be advocacy. We talked about sharing resources. Peers may work in the community and building community and relationships, promoting the very real fact that recovery is possible, helping to reduce stigma in their community. We talked about peers leading groups. And then this idea of helping folks build recovery capital that Kim mentioned. And recovery capital, when we think about internal and external resources, it's our sense of purpose. It's having a job that it fits with our sense of purpose, or going back to school, housing, transportation. There's actually a very specific tool called the Recovery Capital Scale that is an evidence-based research tool that really can help guide the work of peers in doing recovery planning and helping folks do goal setting, moving their lives forward into the future that they want to have for themselves. And helping, we always say in the training that my organization does for peer support across Kentucky, is that we help people realize their dreams and move those dreams, not from something that's just a dream, to a very real reality that you can believe is possible for you. There's nothing like going from a life where everything seemed impossible to one where the things beyond your wildest dreams seem possible. So peers inspire hope, right? That people can recover, and for the individual that they can recover too. When you're talking with somebody who's been exactly where you are, who really was hopeless, was in jail, was homeless, was living in their car, and here they sit in front of you like with a job, and they're buying a house and they have their kids back. It gives you an unbelievable amount of hope, because if they can do it, you're like, you know, maybe it's possible for me too, right? Peers dispel the myths, and we'll get to see that, you know, today with peers that we've met, and folks who've been so fortunate to be in breakout groups with Bethany and with Marie. They've probably already dispelled myths that you may have had about folks with a substance use disorder. So peers are going to provide different education. And then this whole idea of helping folks really identify their goals and moving forward with their goals. So peers are going to do outreach. We talked about groups, right? All phases of planning and goal setting, but we really look at it as recovery planning. That's really built off of this recovery capital assessment and really helping folks think together about the steps that's going to help them reach the goals that they have. The session I did on addiction as a brain disease, of course, was a long time ago for all of us. And one of the things we may not remember is that in early recovery, our problem-solving skills are definitely not at their very best. So I always say for peers, when you're doing goal setting with folks, you get to be a thinking partner with somebody. And really help them think through all the small steps that help you get to where you want to go, because that can feel really overwhelming for someone who has a very low recovery capital and whose problem solving skills aren't great, and your stress system gets overwhelmed very easily in early recovery. So peers help support people through all of those kinds of things. So now that we've talked to you a little bit about what peers do, just briefly, what you'll get the opportunity to do now is to go into breakout rooms and for just a very short time, about 4 to 5 minutes here, and just to chat about what are some ways that you'd want to be able to collaborate with peer recovery support. As you think about families you've worked with substance use, how would you like to be able to collaborate and access somebody who does these kinds of tasks we've talked about? And maybe what are 2 things that you'd want peer recovery specialists to understand about the work you do with families? And we'll have, when you guys come back out of there, to type your 2 things into the chat so that we can get a record of it, because I personally am going to take that, and as I train peers all over the state for the next upcoming 7 or 8 months, I want to share with them what people who they partner with in the community want to know about them and would want them to know. So
All right.
Brandon, take it away.
For those of you that weren't here earlier, Brandon will do his best to put you into your typical groups. If not, we'll put you where we can, and we'll bring you back in about 4 minutes.
Several of you will be in a different group if you were joining right at 2 or a little after, but no worries. And the groups should all be even though. So here you go.
Brandon.
All right. Well, I know in our group we had some really good conversation. If any of you did get to the 2 things you'd want peers to know, to go ahead and to type that into the chat. I sometimes think of that question that we had as kind of the, oh, if I could take this expertise and use it any way I wanted, what would that look like to me? I'm going to turn things back over to Kim, who's going to talk a little bit about where do you find peer support, and a little bit about the effectiveness of peers.
All right. And just as a reminder, don't forget to put your information into the chat area on ways that you would like to connect with peers, or what issues you would like peers to be aware of in the work that you all partner with. But moving ahead into where is it that we find peer support specialists? Man, literally everywhere. So treatment provider settings, recovery community centers, which are new onto the scene and just super cool. Peer-led engagement and help centers. Has a variety of social activities, job placement help, job skills building, fun, safe activities for people to engage with. Hospitals in our emergency departments and our OB wards, as part of, you all might have heard them referenced as QRT teams, quick response teams, which consist of police officers, fire, EMS, social workers, at syringe service programs, exchange programs, health departments, recovery housing, you name it, child welfare agencies, DCBS, Department of Behavioral Health even. the criminal justice setting, the drug court setting, the family court setting, domestic violence shelters, which is a new partner with Peers, super exciting. Homeless shelters. Literally, you can hear the excitement in my voice, I hope, but literally everywhere that people are that are struggling with substance use disorder, you're going to find a peer service. You know, we were talking in our team meeting the other day about, you know, maybe at Christmas time we need to add peers to the bell ringer service, you know, that you see out in front of Walmart and Kroger, that, you know, hey, we're here and we can help you. It wouldn't surprise me, because they get that excited about being able to connect with people and to start them on that recovery journey. So moving on to, you know, is it effective? Does it work? You know, it all sounds great, but when it comes down to it, does it work? And the emphatic answer is yes, absolutely, it does. People who've worked with peer support specialists, you know, those recovery coaches provide such a strong, credible testimony in their recovery, right? You know, I have to liken it because I'm not a person in recovery, or I guess I am from food addictions. But, you know, it's like we've all done, right, the Weight Watchers program, the keto program, the Atkins program, the only eat cabbage on Monday, Tuesday, Sunday, eat carrots and kale the other day. We've all done all those crazy diets, right? And they work for a minute, but then we go back to habits and behaviors that are normal for us. Peers are that link with that. You know, everything's great for a minute in treatment. We know what we need to do, but how do we maintain that? How do we do that in our personal lives? And that's where peers come in for that. Research, study after study, shows that peer support is the critical link in a person's success for long-term recovery. You know, people that receive peer services, they show reductions in substance use, they show improvements on just a variety of things in their interpersonal relationships. You know, so many burn the relationships with family and friends. You know, people get tired of it, but they can bridge those back and help to start the conversations and the actions that rebuild those interpersonal connections that are so important to all of us as human beings, right? But I think most importantly, peers help people find their own strengths. They find their self-esteem again. They help them to find their why. Why are you using? Why do you want to get into recovery? What's that look like for you? What is it that we want to gain, and how do we get there? They're the fire that jump starts this for the person that's in recovery. So looking at specific things that improve through peer support recovery, they look at, like I was talking about, improved relationships, interpersonal relationships, as well as the relationships with the treatment providers, right? You know, a lot of people, when they get in front of a professional, they shut down a little bit, right? They feel like they're being judged. Whether you're going to a doctor's office or whether you're going to a behavioral health clinical setting, people are afraid to open up and share a whole lot. And they're worried about what those consequences can be. But peers can be that driving force that improves and connects that relationship, so that multidisciplinary help is there and understood, rather than the feeling that somebody's playing gotcha with them, right? Increased treatment retention. They're going to stay in treatment longer when they've got that peer connection. Their satisfaction with the overall treatment program, you know, that peer gives them the voice. They're the ones that initiate that person-centered aspect to clinical services. The improved access to social supports. They're going to help them make those connections in the community that will form and help bond in long-term recovery supports. And they see greater outcomes with housing stability, which is incredibly important for anybody, but especially those who may be systems involved through Child Protective Services and need that stable housing in order to continue having custody of their children. So with the effectiveness, we also see some things decrease, but in a positive way. So we see decreases in their interactions with the criminal justice system, right? They're not going to court as much as they were. Decreased emergency services utilization. So they're not utilizing 911. They're not showing up in the emergency departments at hospitals, not nearly at the rate as before. Reduced recurrence rates with treatment, reduced substance use overall, which lends to harm reduction in our communities.
All right, we're going to move into about a short 5-minute video, and then we'll do another breakout afterwards. But while you're watching the video, what I'm going to ask you to do is really think about one word that comes to mind for you. As you watch this video, what's the one word that rises up for you? And then you'll be able to share this in your breakout group. So we're going to go ahead and run the video. I think that y'all will really enjoy this video.
My dad was a union iron worker, and I watched him wake up and drink beer every day.
I was living on the streets, basically living out of my car. I had 2 warrants out for my arrest.
Started with just a couple lure tabs here and there. Made me feel like Superman, so I was like, well, I'm going to continue to do this.
He almost killed me. I lost my kids. I went through it all. I went to prison. I went to jail.
I've done IOP before. I've gone through drug court. I've been through all these things. I've even been to prison twice.
People got a lot of stories they don't tell all the time. And I wasn't telling anybody about some of mine for 20 years.
It's like fire inside your bones, man. It's burning inside and you can't extinguish it. Your head is sweating, your body's aching, you want to get away.
People are dying every week, and people are suffering.
The problems that we're having today are greater than they used to be. It's affecting every walk of life, every generation.
I had a problem, and I didn't want to continue the way I was living.
The fear of dying of this disease wasn't what scared me. The fear of living through it is what terrified me the most.
You just don't know when the lights are going to go on and someone is going to say, yes, I want help today. And so peers really act as the connective tissue between treatment services, specialized treatment services, and the community of recovery.
Their job is to offer their own experiences to our clients.
My personal story, my education, my training, my life, is giving me the gift to be able to work with people on a level that peer support's able to do.
If you want to do peer support work, remember always that you were once just like the person you're talking to.
Here's someone who's been where you've been and is in this whole different place. And when you see that, it gives you a lot of hope.
My job doesn't feel like work. What it feels like is that I get to help people all day.
There's an emotional roller coaster that goes on during early recovery. And, I want to help them to learn to cope with that.
Many peers come from lived experience, not necessarily very far from their own recovery. It's really important that they understand some of the do's and don'ts, if you will, in terms of what can be helpful and what can create harm.
as a peer support, I feel like it's my responsibility to maintain boundaries with the client, because the client does not understand what boundaries are.
You don't want to come off as too strong, or sometimes you may not want to be too relaxed. You just want to find the medium so you can let them know that, hey, I'm here for you.
Self-care is a big component in this line of work. I just know when I don't take care of myself, it's hard for me to help take care of somebody else.
If we fail, then the people that we're supposed to help won't succeed. And now we're dealing with life and death.
We know that the longer folks stay engaged in the treatment process, the more likely they are to be able to find long-term recovery.
This is how a peer support specialist helps somebody else, by having that lived experience and sharing that with a client.
Once I got sober and started working the steps and started doing certain things, I enjoyed it.
So when I got it, I just wanted to give it to everybody else. It's like, hey, man, you ain't got to go through this again, man. You got it.
One of my good days is when one of the clients says, hey, I got a sponsor, or hey, I went to a meeting by myself.
Find out what it is they want. What is recovery to you? What is, where do you see yourself in a year? What can we do to get you to that point? You know, what will make you happy? Because essentially that's all I want to do, is improve somebody's quality of life.
Sometimes we're not strong enough to fight for ourselves, and it's just somebody having faith in us until we have faith in ourselves. I want to fight for them.
All right, that video is produced for actually the Department of Behavioral Health, and is part of something that we use across the state in peer support training, but it probably does more than anything we could ever tell you about the work of peers. So I think our breakout rooms are going to be a bit shorter than 10 minutes, probably about 5, Brandon, if it's not too late to kind of switch that a little bit. But based on the video, if you all can share with each other, what was that one word, right, that came up for you to describe the work of peer support specialists? And then maybe think about a couple ways that you might be able to leverage the knowledge and lived experience of peers in the work that you do, or to increase your own understanding of substance use disorder.
Okay,
And we're
5
ready.
minutes. Here you go.
Sharon, any wise final words till we move to the next wonderful segue that we have?
I think the only thing I was going to add, because it came up in our group, and one of our participants asked about, were the folks in the video real people or actors? And they were all real people. And we always like to thank Centerstone, or now 7 County Services in Louisville, who worked with us on this project. All those, except for the couple of two administrator folks, everybody else in that video, well, and except me, were all peer support staff at that time. And a lot of them still work as peers and work for 7 County Services in Louisville, and shared their wisdom with us for that video. So.
And their passion. I think that video does such an incredible job at, you can feel the passion that they have for the work that they do, and wanting to provide that hope for other people that are just beginning their recovery process. So well done.
Right. And I think you all have done a wonderful job of starting the discussion on what peer support specialists are. And we're going to transition shortly to 2 peer support specialists who are going to share with us, who have been a part of this series the whole way. What I noticed is that all of us in this series have that same passion that people in recovery have. All of us have the same passion to support families and children in recovery. So I will share my screen and introduce our next presenters to you. We are fortunate to have Bethany Wilson and Marie Weiss with us today. They are peer support specialists. They both work for Pathways, which is a program at UK. that works with pregnant moms and babies as they deliver them. Bethany and Marie are both, they've been an active part of this series all the way through. They've been facilitators in our small groups. They both work in all the areas that Sharon has outlined, Sharon and Kim have. They work on prevention, intervention, rehabilitation, and they provide skilled support to families in recovery. Some interesting notes about each of them. Bethany is also a mom of 6, and Marie is a mom of 4. And I think a fascinating comment from both of them is that they are much more than you think they are. And I would have to agree from reading the information that they sent me. They have wonderful skills. So I'm going to stop the share and I will just turn it over to Bethany and Marie. They're going to talk with us. I will show you what questions they are. They're going to talk about from the lens of families. First of all, what's helpful for providers to know about peer support specialists and families in recovery? And secondly, what is less helpful for us to do as providers with our families in recovery? So Bethany, Marie, I will turn it over to you. You let me know if you want me to post the slide or if you just want to speak without the slide showing.
Yeah, we can. I don't mind it. I don't think Bethany does either. But I know I wanted to thank you for having me be a part of this, and I enjoyed the time I got to spend and the people that I've got to meet in our small group. And for me, of what I came up with on that question, just in my life, when I entered into recovery this time, again, the one that has changed my life, I've been in and out of recovery for 20 years. This is the one that happened to stick. So thankfully, when I'm with other providers, if it's dealing with my child's pediatrician or if it's dealing with providers when I was still receiving services of my own, it was most helpful just to treat me as you would the next person. Don't judge me, don't condescend me, don't assume that I still live my life the same way I did when I was in active addiction. Because out of any bias or anything, once they see that SUD diagnosis, it was, oh, well, we're dealing, right? And sometimes I could just see a whole provider change that quick. And that really makes us second guess our parenting. It makes us second guess that whatever that situation would have been. So that was a big, and still is a big thing for me. I don't choose to tell people I'm in recovery until I see if it's needed or not. All of the women that we work with at Pathways, they know we're all about what we do. Bethany and I are there for them any step of the way. If it's going, I've been to case plan hearings with patients. I've been to all of those kind of different things with them. But the biggest thing for me is any other provider that would be dealing with a family of someone who's got SUD or, whatever. We are striving to be as normal as you guys are, okay? At least in our head. So if you can treat us like that, that makes it a lot more better. Does that make sense for me? I think the other part of it is to be aware that if you're clear and direct with us and what you need us to do, that works a lot better than beating around the bush too, right? Because we can create mountains out of molehills. So very clear, that's my notes I have, very clear directions or suggestions if the disease affects the way it affects me, at least. I can't have all that jargon. I can't have all that big words. Just please tell me if my kid is sick or not, or whatever the case may be.
Thank you, Marie. Thank you. That's really helpful information. Bethany, you want to share?
Yes. So there are some of the things that Marie said that I had identified myself. I think whenever something that was helpful for me was that providing that same care, communication, and information that you would give any other parent. Also, regardless of if I am a first-time mom or I have had 3 children, keeping in mind that that doesn't necessarily mean that I have parented those children. So really, you know, treating it as this is a first-time mom. I think like the provider using language that reflects professionalism and respect. Having treatment providers, I had the opportunity to receive care in the same clinic that my child's pediatrician was. So that really helped. They understood that I was in a program. There was that communication between my provider and the pediatrician. And when she would mention things, or if she did mention something, I knew where it was coming from. I knew it was coming from a good place, and genuine care and concern. So that was something that was really helpful for me. And for me, to having them appropriately educated on the disease of addiction, you know, some things that were not helpful when working with providers is, well, first I want to say individuals in recovery often expect others to judge. Like we can easily perceive language differently than someone else might. So I think, and you may not know who is or is not in recovery. So just keeping that in mind as you provide care to anyone. But when providers have made assumptions, whether that's assuming that things are a result of addiction or NAS, not to say that like that being their go-to, without explaining why they came to this conclusion. Because in my head, I'm like, well, they're just saying, you know, they're just saying this because it's like a default. And so I think for me, it's been important to really explain why those conclusions were made. Or if you have, I think the assumptions is a big one that can be in all different areas, assuming that, like Marie had said, that what my home life looks like, assuming that I'm unmarried, assuming that, you know, even that I haven't parented. So all of those assumptions are not taken very well. And we often have low self-esteem, especially early in recovery. We have a lot of guilt and shame. And so in working through that, I think it's important to give positive feedback. Yeah, you know, little things. I know Our Lady is in our program. It's like, oh, you know, I hear and I'll say like, oh, you know, your little one, you can tell she just loves you, and you're doing so well with giving her this attention, and, you know, all just certain small things, and just encouraging them has been beneficial in my experience and also in others that I've worked with. It can make a huge difference.
Thank you, Bethany. What I hear you both saying is that it's important that we treat each person with respect, because we don't know the journey that any of us are on. Marie, Bethany, would you share other things, suggestions of what providers don't need to do? I heard no judging. I heard no assuming. Any other suggestions of what we don't need to do as providers?
That, I mean, in my way and in my experiences, my son has a very rare bleeding disorder, and when he was diagnosed at birth, I had a provider just dive so deep into my history as if I intentionally passed that on to my son, when it was an actual genetic mutation on my DNA that passed on to my son. So that was within UK, and that was very hard to deal with, because I was like, my past could not and I'm not that smart, but I know my past did not bring this on my child. So I think just with that one situation, that could be as useful as well. And like Bethany says, you know, not all of us are single and unmarried and we had all these kids and we're living off the state. No, that's not necessarily the situation in the long run. I think what's another one that I think I've had issues with it as well in the past, and I've helped moms that are in our program now deal with it. We have to learn, and when I say we, those of us in recovery, we have to learn as much about our disease as anybody else does before we can learn how to manage it. So therefore, if providers not every provider is an addiction medicine specialty, and they're not on every block. So if a provider would at least take the time to educate themselves just somewhat about the disease of addiction and how it could present itself, then that would help so much more, because you don't know who's in recovery until they tell you or you ask, right? I know providers, I know healthcare professionals that are in recovery, and we talk about this all the time. So I think that's a big thing off the top of my head for that.
Awesome.
Piece.
Thank you. Bethany, anything you want to add about what we do not need to do?
Goodness, I can't think of anything right this minute.
Okay. No pressure. I want to give all of the participants a chance to ask you any questions, clarifying questions, before we go into our last brief breakout. Anything anybody wants to ask directly to our wonderful peer support specialists? Okay.
You can also,
Caroline. Yes, Miriam, go ahead.
As usual, I have something to ask. So I'm thinking about the idea that if we come in with the assumption as a provider that you are your own expert, you're the expert on you. But I also am mindful of the fact that I don't want to always be saying, well, what's helpful to you or what do you need, and put you in the position of having to tell me how to do my job, right? And finding that fine balance. So I'm just curious if either of you has a thought about that, about what's been helpful in your experience, or where that line can be that we can find.
I think that's a very good thing to bring up, because yes, we are not medical professionals. We do not know what's wrong with us or what's wrong with our head, even though we think we do sometimes, right? So like I said, as far as for me, I needed that very clear and direct. Well, this is what's worked before, and I'm sure maybe if you try it, then please let me do my job. I appreciated honesty from providers more than anything. I had a provider very early on in early recovery who was very clear and direct and no BS. Because I can manipulate BS. I can get around that, and I can make that work out the best way I want it to in some situations, and sometimes all situations. So dealing with a provider that knows their job and is being clear and, okay, Marie, this is what we're doing, right? Because this is what we know to work. We'll do it because we trust you, because we know that you are who you are. You're the provider, right? Most people go to the doctor and do what the doctor says. We're that same way. You know, so as long as we know that this means business, I don't know how else to explain that really. But I think that's a very good point, Miriam, because we will think we know what's wrong with us. And I'm sure you come across people like that all the time. But for those of us in recovery, having very clear direction, right? Sharon, help me out here.
Well, I know for me, as it relates to like my child's provider, I have, even prior to being in addiction, have had a pediatrician we were struggling. It was failure to thrive. And I had an older child who was doing very well. And what they wanted to do was put someone in my home to watch that child eat. And how that made me feel is that, you know, I'm assuming that they don't think I'm feeding my child. So I think, you know, giving good suggestions on things that, you know, of course there's times where you have to, you know, they need this or that, but giving options or suggestions for me to kind of help, you know, do some explore a little bit and kind of see with them. And it depends on your profession. You know, if I take my child to the pediatrician because they have some infection, well, yeah, I'm going to give them that antibiotic. Now, if it comes to my child's behavior, giving options that you have seen to be helpful. You know, I know from listening here, my son has had some behavior issues, and listening to just these suggestions have been really helpful, and I've been able to take those and try them with him. So I think in that case, suggestions are really helpful, and just continued communication with myself and whoever that person providing care is, whether it's First Steps or you know, whoever's providing care to my child.
Bethany and Marie, you guys are getting rave praise in the chat box. I want to thank you for sharing what you do with us in such an honest way. I want to give everybody a chance to go into your breakout groups one last time. Brandon, probably no more than 4 minutes, just to kind of share your thoughts about the peer support specialist, what we've just heard, and we'll be back in about 4 minutes. Welcome back. We are closing in on sadly, the last part of this session and the last part of this session for this fall. But we have a couple of poll questions we'd like to ask you all to get some, at this point, we want to kind of pull together what we've been talking about and get some feedback for our series moving forward. And I want to thank every one of you for participating and making this really a great session. I want to thank Sharon and Kim for presenting today, and Bethany and Marie for presenting today. Everything that you all shared was so valuable. So Brandon's going to put up a couple of poll questions for us. The first one is, we'd like to know what length of session you prefer, either an hour and a half or 2 hours next time. And then Brandon, if you want to switch to the next one, our second poll question is, we'd like to know, for the most part, put everyone in geographic breakout groups. We want to know if that was helpful for you. For our next series, do you recommend we continue the geographic grouping or not? Okay, great. Brandon, you can end the polls, and we're just going to go now to just some open discussion until we close out with our evaluation reminders. For these questions, you can either, I think probably would be best is you put your answers in the chat. That way we can share them. I'm going to stop sharing so I can see you, and I can also see this chat, but I'll ask you the question. So we'd like you to enter in the chat which of the topics we had this series were most helpful for you, and what topics would you like to see in our next series. So what topics that you've heard were most helpful, and what topics would you like to see next time? Know that we have been recording your evaluation information every session. We have gathered some of this information from you, but we wanted to give you a chance here at the end to talk about what you'd like to see next time or what you would recommend next time. Okay, and I'm going to let you continue to enter in the chat as we move on with other discussion questions. The biggest question that we would like to hear from you all, and again, you can enter in the chat or you can unmute. We'd like to know, this is the first series that we've done to look at services for children across the state, children with NAS, and how to support their families. We'd like to know what ideas you have based on this excellent group of experts we've had through this series and the excellent group of peer support specialists. What are some ways that we can increase the collaboration across the state in our services to this diverse group? And you're entering the information on the sessions, that's great. So now I open it up for you all to talk about what are some ways that we can increase our collaboration across agencies, across the state. What ideas do you all have? And feel free if you want to unmute and discuss or in the chat. Kate, did you have an idea?
Well, I'm thinking about the geographic breakout groups.
Yep.
And that if there was an opportunity for multidisciplinary groups as well to really hone in on having that community of practice lens come out of those breakout groups, and thinking too about ways we might be able to have session topics or not just the topics, but the case studies that could lend themselves specifically to that geographic and multidisciplinary approach, so that when people leave, they now have their go-tos, which I think some of that got created now, but to strengthen that.
Great suggestion. And we encourage you all to use the resource site that will stay up and to use the Slack site. If you have any trouble with that, email any of us to keep in touch. Now that we have some new connections established, we encourage you to stay connected that way. Other thoughts on how we can increase our collaboration across the state?
One thing I'd encourage folks to think about is getting involved with the local plan of safe care groups that are really trying to bring providers together to work in collaboration for families who have substance affected infants. So you can find those folks through your local community mental health center, or if you can reach out to me or Maggie Schroeder, we can connect. So we really need everybody who's working with families really to come together and coordinate, because the needs families have are bigger than any of us. And all of us working together makes it a lot less overwhelming for families. And we just do better when we work together, and it's more fun.
Agree. Thanks, Sharon.
I'd just like to say, we're working with First Steps, and I've been in First Steps for a while, but a lot of this information was new to me, a lot of resources that I was not familiar with. So this was really, really helpful. I know at times we have, like with First Steps, for example, Point of Entry, we'll do, quarterly meetings or something like that. Sometimes we'll have guest speakers. But if there are some people who would be able to maybe come to certain, I know like our district would probably be open to that, even by Zoom or whatever, and just say, hey, if you have families that are, in need of these services, here are some things available, because our service coordinators are there. A lot of us as providers are there. And that might be a way just for there to be some continuity of, okay, here's some things, and these are kind of some basic go-tos and things that you all have in place that maybe you just haven't tapped into yet.
That's a great idea for follow-up, Leah. Thank you. Great idea. And many of our speakers, Sharon can attest to this, have offered all kinds of services that can be follow-up for this series. So, as you have ideas, as you have needs, please contact any of us on this team to share your ideas, to ask for resources, because we love sharing the resources that we're learning. So please do let us know if there's training needs, resource needs. That's what we're here for.
Anybody who is interested in any kind of like local specific training for their area, more than welcome to reach out to me, and we can get you resources through the Opioid Response Network. There's not a cost to you. We can connect with all kinds of trainers and consultants and so on. Nationally, that's one probably positive thing that's come out of the situation we're all in, is that we can tap in folks nationally a lot easier because we're all getting used to virtual. But if there's specific regional needs for training or so on, that we are here to help with that in any way.
Other thoughts on increasing collaboration across the state? Well, I encourage you to enter in the chat. The last question I would love to hear from you all on, and again, you can enter in the chat or you can unmute, is what's one takeaway for you from this whole informative series? What's something that you're going to take into your practice or into your life based on all of this information we've learned? What's a takeaway for anyone? Give you a moment to think. You can put it in the chat. You can unmute. Partnering, absolutely. Partnering is key with families and parents. Collaboration. Yeah, there are lots of resources, aren't there? It's great that we're beginning to find out what they are. And yes, we are all important components for creating a system of care. Absolutely right. Consistently educate ourselves. There's a lot to learn about this whole system. Yes, see me as I am, not as my past. Yeah, it does affect all of us. This opioid epidemic, when none of us are untouched. The more we're educated, the more we can serve effectively. Jason, any last words of wisdom from you? I see you there.
I don't know if I have any real good words of wisdom. I did get to share in my breakout group. One of the things, again, on this topic of peer support, one of the things, it was good to hear Marie and Bethany share, and then we've also worked with Sharon, just to see how bringing peer support into whatever our systems are helps destigmatize the disease of addiction. People get to see what long-term recovery looks like. That gives hope for a lot of us that are in the trenches and working with families where addiction may be present, and we can get very frustrated and we can get very burned out. And so when we bring peer support, it changes our systems, changes the way we work. And so I love it that we're inviting peer support into almost everything we're doing now. When we're talking about families and working with families at risk, it changes the way we do our work. And so I thank Scope for making that a part of this. And I think that everybody here that's participating has that. We're all like-minded in that, is that we want to know more about how we can help people with this disease and have an impact on these families that are impacted by it. And part of that is bringing in the people who are in long-term recovery alongside as advocates and linking arms with them in this fight. So it's good to see all that.
Well said. Very well said. Thank you. We're also getting some other great takeaways. How parents vital are in the treatment process, letting them be active contributors, honor their voice, setting realistic expectations. We heard Marie say how important it is to be honest and say plainly what's going on. Connecting with patients is a vital part of being a peer. Working with being aware of our own biases, absolutely. Yeah. In terms of contact information with other folks in the series, early on we asked for who was willing to have their email shared. we might include that again in our final evaluation note, and you can let us know. We would never share anyone's email without their consent. So if we're able to, we'll ask that question again, and those that are willing to have their email shared, we will do that.
And also about the Slack channel, I'm seeing a lot of people are joining right now, which is very exciting. But the Slack channel is for you all to put your thoughts and continue the conversation. We keep an eye on it, but we don't really populate it with any kind of information. So I will link in the chat to the HDI Learning site, and that's where we put all the resources in one spot. But feel free to talk over chat. I think or Slack, it's a great place to kind of just keep a conversation going, and you can start threads and bounce ideas off each other and that kind of thing. It's more interactive, I guess, than the HDI Learning site. But.
And Miriam, I was going to ask you if you just want to share a little bit of detail on the resources that we shared today on the PowerPoint. Do you want to say a bit about that?
Yeah, I just really quickly, I realized afterwards, and this was, I think Elizabeth was really the one who followed up with me. I realized that I hadn't shared a great resource for child care providers and early childhood educators, which is an adaptation of PCIT. So it's a trauma-informed, evidence-based intervention that is intended for non-direct caregivers in the sense of parent figures, but other kinds of caregivers who are with kids on a regular basis. And it's a short training. It's a 3-hour training. You can get it here in Kentucky. And I just didn't want you to not have that information. So it's pretty self-explanatory with the links that were in today in the slide that Caroline made so nicely out of my email to her. So yeah, just another resource.
Great resources, thank you. So any final comments, takeaways, comments on today's great information? Well, we appreciate all of you being here and making this a great series. We will be doing another one next fall. Actually, one in the fall and one in the spring is our plan for next year. So please give us your feedback. I'm going to turn it over to Emily now, who will take us out with evaluation information.
All right, so you are going to be receiving 2 evaluations today, one specifically for this training, and then one about Project Scope, the whole training. So the one specific to this training will be similar to the ones that you've already done, pretty short and sweet, but I will say that the one about the whole training is a little bit more lengthy. So, you know, it asks questions about every session. So it'll be, I would say it would take 7 to 10 minutes to complete, just so you have a heads up. And again, if you have any issues with getting the evaluation link, just email me directly, and I'll just send you the direct link, because I know a lot of the times it goes to your junk folder, or it doesn't show up, or it gets filtered out because it looks spammy. So any issues, just email me. And soon we'll be sending out the survey for people who have attended all sessions and get the book. So it'll add, in the last email I sent you, I listed out the 4 books. So if you respond to that, I'm sure we'll have an end date for that survey and we'll send it out. But does anybody have any questions about evaluations or suggestions?
I do have a question about the continuing education, and could you reiterate, I think, is Brandon in charge of that, and how do we go about getting any continuing education units for the series?
This is Christine. I can speak to that. So
okay.
No, you're good. You're good. So anyone who was needing credit in ECE Trust, those are our early care and education folks. That has been entered like as the weeks have gone by. And then for those of you that are not early care and education folks, we have provided on the resources website, which Emily, do you mind are you able to post what that information is? And
Yeah.
there is, there all the resources that you would need to submit to whoever your lead agency is. So if you're speech, then like we have all of the presenter information as far as the topics and the descriptions and the presenter bio and the presenter resume and all of that. So we have all of the information that all of these entities usually ask for, but because we have so many different professional organizations represented, we just thought we would kind of give you the tools, and then you could pursue that depending on who your individual board is. If you have any questions or if you're missing a piece, certainly let me know and I can help gather that for you. Does that make sense?
Okay. Yes, thank you.
All right.
So circling back to the evaluations, I just want to say that we appreciate your feedback so much and we really value it, especially since we are going to be doing more of these. Your feedback is very important to us and we take it very seriously and read all of your suggestions and incorporate them. So please feel free to be as verbose as you would like to be in your feedback. Thank you. Also criticisms, any suggestions for improvement, we're open to all kinds of feedback. This is our first time, so, you know, anything that we can do to help you further is our goal. So just throwing that out there.
Well, if there are no further questions, we will close for this series. Again, we appreciate each of you. If you have any questions, feel free to email any of us. And have a wonderful holiday season. Everybody be safe.
Yeah. Don't be strangers. We do hope to hear from you.
Yes.
Thank you.